Project Echo has been called a performance optimizer. Think of it as a high-speed internet connection for the healthcare system, spreading new medical knowledge from university medical centers to the front lines of community care. But rather than information flowing just outward in one direction, these community providers learn from not just the specialists at the university, but also from each other. Using the latest video technology, community providers are guided in the care by specialists back at the medical school, acquiring new skills that allow them to treat patients that they otherwise would have referred out. It's a treatment model that was developed in the wide open spaces of New Mexico by this man.
I'm a specialist in liver disease. I used to run a dedicated hepatitis C treatment clinic in the university. Some patients would travel 200, 250 miles each way to Albuquerque to see me.
He's getting his diuretic therapy, he's getting
I found it extraordinarily frustrating that some of these rural patients would come to me at too late a stage. I always had that nagging thought that if I had just been able to treat them earlier, I would have been able to prevent this problem.
If you're in a remote area, the specialists that I need and that Ashley needs, we don't have those specialists. We'd be traveling once a month out of town, quite a ways.
Go ahead, Angela.
Thank you, Dr. Bankhurst. Patient LO is a 39-year-old patient.
Over the last 20 years, I recognize what are we going to do with this massive number of people that have to be seen by us. And fortunately, through the ECHO program, I can finally access these people.
So why don't you just hold the hydrochlorothiazide?
Okay.
Let's stay on everything. A local ophthalmologist started sending me a whole bunch of patients with possible Sjogren's syndrome. And I'm sitting there on the computer going, okay, I know what Sjogren's is, but how do you work it up and what do you do? And it just sort of started from there. But I did do a full autoimmune workup on her, which was all negative, including during the sessions, I'm able to make suggestions and ask questions or clarifications, even if it's not my own case. It's a giant mind center of collaboration.
And since its development, the healthcare outcomes at the remote sites have been equal to those at the university hospital. That's why the ECHO model is now being implemented by OSU Center for Health Sciences here in Oklahoma. Earlier, I sat down with one of the health center's top docs here in studio. Well, joining me now is Joe Johnson with the OSU Center for Health Sciences. So OSU really does focus on our rural areas.
Oh, most definitely. About 70% of our medical students actually, when they finish up their career, go back into those hometowns that they originally came from. Dr. Schrum was very innovative in starting with the blue coat to white coat, taking kids from the farm associations and actually putting them through college with OSU, and then putting them through the medical school there at OSU.
Mm-hmm. And Project ECHO will help rural health in which ways?
Oh, we're so excited about this new project. It's been going on since 2003, but we'll be the first hub site in the state of Oklahoma to be able to provide specialty care actually into the rural areas. What we find is that it's so difficult for people in the rural areas to get the same specialty care that they can get in the inner cities, such as Tulsa or Oklahoma City. And through this new method, we will be able to train those local doctors in how to take care of their patients in state-of-the-art technologies for their hometowns.
What are some of those specialties that you'll be focusing on?
Well, what we've done is a needs analysis through the state, and we see 5 major areas that are needed. Mental health disorders is so critical. We still have a high suicide rate in Oklahoma. We fare fairly poorly in obesity. Over a third of our population is now considered to be obese with all the disease processes associated with that, such as diabetes, hypertension, coronary vascular disease. So those are 2 main areas. Then addiction medicine, which will get into our correctional facilities also, trying to prevent people from going back into the prison system. We're going to also be dealing with viral disorders such as HIV and hepatitis C. And then the last area is dealing with our youngest population, our newborns, and that by getting to have healthy mothers, dealing with high-risk pregnancies and things associated with pregnancy-related care in the rural areas.
Yeah, well, let's get into the specifics. Exactly how will this video conferencing work?
Oh, it's kind of a neat way of doing things. So education should be free, and sometimes it's difficult for rural doctors to be able to stay as current as the academic facilities. So through a greet and each over a lunch hour, doctors can join in through video conferencing, and they can actually present patients to our team of specialty doctors to where they can give them recommendations on how to take care of and treat their patients. The doctor-patient relationship stays in the community, the healthcare stays in the community, but they get to learn new innovative ideas of how to take care of their patients.
All right, well, certainly it's an exciting program. Thank you so much.
Thank you.
Dr. Joe Johnson is with the OSU Center for Health Sciences.